Mate, I'm always happy to share our story about how Eco Energy Youth started. I became a mental health nurse by default, actually. At about 26, I became a dad for the first time, and I was one of those people I didn't have a career, I didn't have any formal qualifications. I was probably working in a job I didn't particularly like so much, and that purpose and passion was definitely not there. And obviously having a new baby come into the world with responsibilities, a husband and a dad, I was very fortunate. My firstborn daughter was born, and when we turned up, my wife and I, the first midwife was a man, and our midman, and he was absolutely fantastic, mate. He looked after my wife and I and our daughter right through till she was born, and I just went away from that experience thinking, you know what, I like people, I'd like to help. I wonder if maybe I could give this nursing caper a go, and I had absolutely no idea how to go about it, but that set me on the journey. And so what I did was applied and became a trainee, hospital-based trainee enrolled nurse, and I was very fortunate. I went along and went through the process, and I got interviewed, and one of the nurses on the interview panel said, "Have you ever thought of working in mental health?" And I thought I hadn't, and and that's where it started. So I was very fortunate. I did a 1-year traineeship working in a psychiatric rehabilitation service, that beautiful part of the country at Lake Macquarie at Morisset Hospital, and I was really fortunate to do that 12 months. I really had no idea what I was doing at the time when I look back on it, but that's where I really did enjoy it. Met some amazing people, and then at the end of that 1-year traineeship, I was able to get a job working in a medium secure forensic unit. I was very fortunate there. I worked alongside psychiatric or mental health nurses that had been doing that role for longer than I'd been on the planet, and some of them, my early mentors. I've got a lot to thank them for, and I could list a couple of them in my head right now. And I spent 5 years working, doing that hospital-based training and working and learning about mental health and psychiatric conditions, and working with men aged 18 to 65 in a really restrictive environment, who live with their mental health symptoms every day, and how we could work and support those men. And one of the things that I realised in that time was that if we look at the really early developmental years of many of those men, there were some real challenges for them. So when I completed my degree at Newcastle Uni, I decided to become a new grad, and I decided I'm going to go and work with young people, and I've been working in acute mental health unit for young people up to age 18 in the inpatient unit in the emergency department, doing assessments, and working in a CAMHS specific inpatient unit, and I've been doing it for over a decade now, and still love it and still turn up. I guess alongside that clinical experience, I've done some research as well, and one of those things was that when I first started working in the CAMHS inpatient unit, we would often use what we call coercive interventions, such as chemical sedation, physical restraint and seclusion to manage hot episodes of distress where there's aggression and violence and high levels of distress. And we know that those coercive interventions, firstly, they're traumatizing or re-traumatizing for people, especially young people, but also they're not the types of skills that you can learn in hospital that are transferable to the community. So I thought to myself, okay, I'm going to do this research, I want to improve my own practice, I want to help the colleagues I work alongside. But most importantly, maybe I can learn something that I can share with the most important people in children's life, and that are parents and families and carers and school teachers, who those sets of people there, they play a massive role in the lives of young people. I often, in our training with educators that we do, I often say that they will do more therapeutic work in the 6 years they spend with young people than I ever will in an acute inpatient unit. So what we did was, when I completed my PhD, where I was looking at the best responses in interventions for young people, and that's where we developed the TAR3 psychological first aid framework. What we do is we go out and we coach that to parents and educators and other professionals, and really build that capacity in the community to support young people through episodes of distress. And yeah, that's been a really great thing. So we started Equi-Energy Youth. We're a charity and not-for-profit organisation, and yeah, we just want to get out in the community and build that capacity so that we can support young people. And you know, it is our goal to improve the mental health outcomes for young people, especially things like youth suicide.